to bring you a personal view on what is happening within that red zone that is the nation's capital, that is Ottawa. Dr. Kwadwo Kyeremanteng is with me this morning. He's an intensive care, he works in the intensive care unit and palliative care physician with the Ottawa Hospital, hosts a medical podcast as well called Solving Healthcare, which looks at how to make healthcare more sustainable. He's in Ottawa this morning. And Dr. Kyeremanteng, I'm very happy to have you on the program this morning. Good morning.
Thanks so much for having me, Heather.
I know you were listening to Olivia's reporting as we were introducing you, and you heard as the course of that Earl Brown. He's a professor of virology at the University of Ottawa, where you were, and I was struck by the clip that he had because his concern is that the hospital system could become overwhelmed, and it sounded, rather urgent, quickly, if something isn't done. But the threat itself, how close do you feel where you work is to being overwhelmed?
I would say we don't feel overwhelmed at this time. I think, when we compare things to the numbers that we saw in March and April, we're not seeing the same volume of intensive care patients with COVID-19. And to be honest with you, I think a lot of the measures that people have taken in terms of masking, in terms of distancing, washing their hands, and listening to public health, I think have helped. And we recently saw, I think it was yesterday or the day before, projections about how busy we were going to be. And so far, we're under those projections. And so, for me, I think as long as we stay vigilant, I'm remaining optimistic. And we did a lot of preparation in terms of if we were to become busier, in terms of, creating more space in the ICU, having more ventilators. But at this point, we're not anywhere near that.
That's great news. Obviously, it is to hear. We wanted to make sure, to get through the eyes of somebody who's right as close, right on the front lines as much as you can get. The numbers from Ottawa yesterday, the number of hospitalizations up by 10 to 48, and 10 of the patients of those 48 currently in intensive care. So you're right, the hospitalization and ICU figures are low, but they are going up. And although things are not close to being overburdened at this point, what would it take to get there? I mean, how easily could it overwhelm things?
Yeah, there's a lot of pieces at play. Like one of the concerns I think is, there's a lot of patients that are waiting to leave hospital. We call it alternative level of care, or patients waiting to go back to their nursing homes. And so that's one of the challenges, is that patients are having a tough time leaving hospital. And that's because of increasing restrictions in terms of, getting back to the nursing home. They want to be able to have a safe environment, less patients in the room and so forth. Mm-hmm. So that's a challenge. But honestly, the work that we did to really create capacity and ensure that we can provide the care for our COVID patients has been immense. There was a lot of preparation back in April. We feel like we have the capacity. We've learned so much over the course of these months in terms of how to manage our COVID patients, what it takes, what their prognosis is. So I think we've learned a lot. We truly did a lot of preparation. And so this is why I think you hear a little bit of confidence in our voice that we can get through this, but we still have to stay vigilant though.
Yes, I mean, the things that you've learned, everything from PPE to, even just to how this virus moves. What do you think is the key that you have taken from the first wave that you're applying right now that is leading to the situation where you're a little bit more relieved about things?
Yeah, I think one of the striking things was how nimble we've been, hospitals have been, in terms of really, being active and learning what we need to do in terms of, adding steroids early in the course of patients, adding blood thinners early in the course of patients. So the management has improved. We've learned that having our personal protective equipment works. Like one of the fears early on was that we weren't going to be able to protect ourselves, and luckily, it's been quite effective in that way. The other thing, if I might say so, is clearly the patients that we're seeing most often in the ICU aren't healthy. Like they've had poor metabolic health in terms of diabetes, obesity, hypertension, which all are documented risk of getting sick from COVID-19. So I would encourage all the the people out there, this is a real opportunity to promote healthy living,
To
eating
learn
well.
from this. Yes.
Yeah, like honestly, to eat well, to get outside for your walks, to stay active. Not only is it important for your overall health in terms of COVID, but cancer risk, cardiovascular risk, all these things, your mental well-being, like all these things can improve by us becoming healthier and more active.
I'm kind of struck by your positivity, Doctor, I have to say, in that, we talked to frontline people over the past months. There has been such a tremendous degree of stress. There has been a large amount of burnout, fear for your own health and well-being and for that of your families.
Mm-hmm.
I mean, are you sort of an exception, or is this the kind of the mindset of your colleagues right now in Ottawa as you approach this new phase?
Yeah, I think, if you talked to me 6 months ago, you might see a different picture, but I think because we've seen it and we've lived it. I have 3 kids at home. We have immunocompromised caregiver, and so we had a ton of fear going into the pandemic. But when you experience it, when you learn that we could get through this, we could manage the patients, I could keep myself safe. We learn from other places of the world that are managing well. There's a lot of reasons to be cautious, but there's also, I think, room for optimism. And my philosophy in general is the stress doesn't help. Like in my line of work, where you got to be thinking on your toes. If you're stressed, you're not at your prime function. So I always, it's important to stay healthy, avoid burnout, keep a positive mindset, and I want to encourage Canadians, as long as we stay vigilant, I think we could get through this.
So tell me, obviously you're focused on solutions. Your podcast is all about that. And obviously you have a very strong mindset as you deal with the challenges before you. But right now, where we sit, when the messages from health and public officials are not necessarily as positive as yours right now, what do you see out there that is, to this point, still the single greatest failing that needs to be addressed?
The single biggest failing, I would just, sticking with that positive theme, I think in terms of encouraging the public, I think we should have a little bit of more of a positive message. I think, say, for example, when it came to Thanksgiving, what can we do to keep safe at Thanksgiving? Hey, let's try and eat outside. Let's try and limit the amount of visitors. One of the things that I love what Tam said, Dr. Tam said, I think it was yesterday, was, we want our kids to be able to go to trick-or-treating, but let's talk about how we can do it safe. Promoting that positive angle in terms of, let's not shame everybody. Let's talk about what we could do and take the power back, what we could do to take control of this thing. And so that, I think, the positive message. And then once again, talking about your metabolic health and getting our population healthier, because this is an opportunity, and it could be such an amplifier, such an important message that I think we could be promoting more.
Well, we'll have to come back to you to continue to do that with further conversations, Doctor. Just so you know, Dr. Tam's statement is our top story today. And we've been talking about how people in the country are getting creative with candy shoots and candy slides and candy sticks to keep Halloween safe as much as possible across the country. A pleasure to meet you, and thank you for being our guest today.
Thanks so much for having me, Heather.
In Ottawa, Dr. Kwadwo Kyeremanteng.